Social sustainability. Social sustainability is the ability of a community to develop processes and structures which not only meet the needs of the individuals that are here, but also the needs of future generations to maintain a healthy community. I work at the Hastings Regional Center, and I see firsthand every day how mental illness and drug disorders affect our youth. According to the Juvenile Justice Guidebook for Legislatures, between 60 and 75% of the 2 million children and adolescents that are arrested every year suffer in the United States have a mental disorder. Approximately 1 in 4 suffers from a mental illness so severe it impairs his or her ability to function as a normal human being. Because of the difficulty in diagnosing juveniles, many of them go undiagnosed until they find themselves in the juvenile justice system. On average, about 2/3 of these juveniles do not get a diagnosis until they find themselves in the juvenile justice system. The Center for Mental Health Services estimates that 1 in 33 children and 1 in 8 adolescents are affected by depression. 2/3 of the juveniles in the justice system with any mental health diagnosis at all have a dual diagnosis of substance abuse. According to the National Center for Mental Health and Juvenile Justice, youths who immediately receive a mental health screening are more likely to have their problems identified and treated. In many cases, however, this does not happen. Screening only occurs after a juvenile has been adjudicated and placed in a correctional facility. There are treatment options, however. There's the community-based treatment, which allows the juvenile to remain at home while seeking counseling, but this is mostly for their behavior and not so much for the mental health issue or substance abuse issue that they may be suffering from. There's out-of-state treatment, which is very costly for the state or the families that are trying to get the help these young people need. And then there is the Hastings Juvenile Chemical Dependency Program. According to the DHH website, it provides substance abuse treatment for young men paroled from the Youth Rehabilitation Center in Kearney, Nebraska. The program has an average stay of 4 to 6 months, and while the young men are there, they must complete MRT classes, individual and family therapy, and they must stay caught up in their school. According to Sarah Forrest, Policy Coordinator for Children and Families in the Child Welfare and Juvenile Justice Systems, I was impressed by the level of caring for youth that we found among the staff and their efforts to provide the best possible treatments for the young men they serve, seeking to help them conquer their addictions, stay caught up in school, and reconnecting them to their families. The Hastings Juvenile Chemical Dependency Program is the only program in the state that treats male juveniles for both their mental health disorders and their drug abuse issues. Senator Les Seiler of District 33, Nebraska said, "As many in the community know, the Hastings Juvenile Chemical Dependency Program is a very important and unique program. It is the only one of its kind in Nebraska. And for many of the young men in the program, it is their last chance. Until 2015, no one was accepted into the program until they had failed at least 2 community-based programs. Most of the inmates there have failed at least 4 of these programs. Many of them have backgrounds that have made community-based programs and treatment centers hesitant or unwilling to accept them. The future for many is uncertain. The Hastings facility has secured funding for renovations of the building that houses the program. According to Jean Luther, Safety Coordinator at the Hastings Juvenile Chemical Dependency Center, the current building was built in 1936 and is in desperate need of renovations or remodeling. The program is currently waiting on bids to complete the renovations. The community is also waiting to see if a 200-bed facility to treat inmates with behavioral problems and mental health and substance abuse issues is going to be established in Hastings. Hastings Mayor Vern Powers thinks it's a good deal for the inmates, it's a good deal for Hastings, and it's a good deal for Nebraska. And hopefully, mental health screenings will become more accessible for our youth. According to the DEX directory, there are 11 listings for counselors in Hastings, but none of them specify that they treat mental health disorders or substance abuse disorders. There are 7 listings for psychiatric help in that same book, but only one of those treats juveniles. There is only one listing for a drug treatment facility, and it does not treat juveniles. The mental health and substance abuse needs of our youth challenge us to respond with effective evaluations and intervention. Active partnerships with mental health community and child-serving organizations can improve the care and treatment these young people receive and promote healthier results for the individuals, the families, and the communities. If social sustainability is the ability of a community to develop the processes and structures to meet the needs of their current and future members, then we as a community need to do more to make sure that we are doing everything we can to make sure that that happens.